Hello everyone. Excellent evening everyone. Welcome to every one of us. Happy new week. We are all welcome to this evening's broadcast. Welcome to every one of us. How are we? How is our week going? I hope we are enjoying the new week. We are going to be looking at menopause and heart issues. Menopause and high blood pressure and the rest. So we are all highly welcome. There is a lot to learn today. There is a lot eye-opener. Hello Oji, Aliowo, you're welcome. So also share with your friends. Let's also share with our friends. Let's also share so that other people can learn. Other people can get to know what we're doing. Other people can join this wonderful page that we always teach you how to live and age healthily. Okay, so let's also welcome people to join by sharing with people. I'll just share in the last two pages and then we'll move on. Today we're looking at heart menopause. Heart diseases in menopause that to tell you is preventable. What are the relationship between menopause and heart issues, high blood pressure and the rest? That's what we're looking at today. Hello Nancy, David, you're welcome. Good evening, welcome. And again, I'm going to be sharing with you 7 signs your heart is changing during menopause. 7 signs to show you that your heart is changing during menopause. And then we're going to be looking at what to do to prevent heart diseases during menopause, before menopause. That's all we're going to be looking at today. Welcome. Like I said, today we're going to be looking at heart diseases in menopause. I'll show you how it's preventable, that you can prevent it before you enter menopause. Even while at menopause, you can still actually prevent having heart diseases, okay? And then I'm going to be showing you some signs that your heart is changing during menopause. I'm going to be sharing some of the things. Thank you for the thumbs up. Lovely. Thank you for the thumbs up. Thank you for the heart. So, many heart conditions that are common during menopause are very preventable and also reversible. If you're already having it, it can be reversed. If you don't have it, you can prevent it from coming. Like, there are some symptoms of menopause that we have, like hot flushes, insomnia, night sweats. They can come to you. You remember them anytime they talk about heart diseases. You remember hot flushes. You remember insomnia, not sleeping well at night, sweat at night. You remember period irregularity. You remember all this. But one thing that many people don't remember and don't think about is heart diseases. And yet, it should be one of the things that are high in our list anytime we talk about menopause, because they are related. Any heart issues and related heart conditions are very, very important for anyone that is perimenopausal, menopausal, or postmenopausal. It should be at the top of your list when you're thinking about your health, because heart diseases is one of the top killers of women, and a woman's risk for heart diseases increases very much and dramatically when she reaches her menopause period. It increases dramatically, and it increases so much when one reaches that. So one needs to be very, very careful. Of course, we know that menopause period is between the ages 50 and 54. That's when you enter your post-menopause. But your perimenopause starts from around 45, and some people who have early ones from 41, and those who have premature menopause from about 35, 37. That's premature menopause. So actually, I always advise women, once you're up to 30, 35, you need to note that you need to do some kind of diet changes, some kind of health changes, exercise routine, and you must stay on supplements, because the food you're eating will not be enough then. That's the truth about the matter. So during menopause, levels of the female hormone estrogen drops significantly. That's one thing that makes you enter menopause. A drop in your estrogen level, an erratic and dramatic, leveling of your progesterone. So these are the two things that would cause and make you be at risk of many diseases. If a woman is having menopause, a woman who have gone through perimenopause, menopause, and is now post-menopause or is during perimenopause, also have other heart issues and risk factors that the person go through. I'm going to read through them for you. So once you have reached your menopause, you need to watch these diseases I'm going to mention. You need to be sure that you're going for your checkup. You need to be sure that all the health practices that you need to maintain, to stay away from all these diseases, that you're maintaining them. Like if menopausal heart disease, the risk factors include 1, diabetes. People who are diabetic are at a much higher risk of having menopausal heart issues, heart diseases like high blood pressure, and some of the ones I'm going to mention later during this broadcast. Then women who are smoking, or women who are secondary smokers. What do I mean by secondary smokers? You're always where someone is smoking, you're inhaling the smoke. Like if your husband is smoking, or someone around you in the office is smoking, and you're inhaling the smoke, you're a secondary smoker. So all those people who smoke, they are at higher risk of high blood pressure than other people. Okay, so then if you're also at a higher risk of high heart diseases, if you have high blood pressure, consistent high blood pressure, if you have low lipoprotein, high density lipoprotein, if you have low density hypoprotein, you are at risk. That's the bad cholesterol. If you have low density lipoprotein, you are at a higher risk of having heart diseases. And then if also you have a low level of high density lipoprotein. So now the good cholesterol is called high density lipoprotein, and the bad cholesterol is called low density hypoprotein. All right, so then obesity, that's overweight and obesity, is also one of the things that would cause high blood pressure. I've always told us that when I treated heart diseases, high blood pressure, and the rest, I think it's sometime last year, yes, I talked about it. Then inactive lifestyle. When you're sedentary, when you're inactive in your lifestyle, it can also cause heart diseases and bring all these things. And then the last one is if you have a family history, if you're in your generation, they're having issues with blood pressure and diseases, then you can also be at a higher risk. So we need to be careful about our lifestyle. If you're having a sedentary lifestyle, it's not good for you. You need to be active. You need to, when we say active, we don't mean you should overdo. We don't mean you should, like I always tell us, overdo whatever you're doing. What it practically means is that you should just make sure you are not in one place, because many times from middle age and above, we are already reaching our retirement age. A number of us are retiring from our active work. We are retiring from active work, and so we are not really doing things the way we would usually do. So we are not really very active in our jobs. We are not really active in all the other things that we are doing. So we go sedentary, we go inactive, we just stay without doing things. But what I'm saying is that we need to be active. So if your sedentary is not good for you, you need to be active. So like I said, we're looking at the heart disease and heart issues during menopause are preventable, and they are reversible. They can be reversed. I'm telling you, there are a lot of people who've had blood pressure, who've had some kind of heart diseases, palpitation and the rest, and they were reversed because they did what they are supposed to do. And that's what we're trying to do today. So if you're running a sedentary lifestyle, or in your family, some of these heart issues, heart problems are running in your family, then you need to be very, very careful. You need to be very, very careful. Estrogen drops and your blood and your body responds. That's what I want us to look at. When estrogen drops, how does your body respond to the drop of the estrogen? Now, irregular menstrual period is one of the signals of a decline of protective estrogen level. There is your hormones are supposed to have your hormonal levels, and the numbers that they have certain levels that are okay, that they will say that your health is normal. So when that hormone level fluctuates or drops, it affects your health generally. So one of the ways you know that your estrogen level is dropping is when your period becomes irregular, especially for people who already have irregular periods. In fact, people who have irregular period, no matter the age, are having fluctuating hormonal levels. That's one thing you should know. So if you have been having regular period, every month you have your period, but suddenly 2-3 months you're not having it, it comes again, 7 months you're not having it, it comes again, that's one major sign that your estrogen level is declining. So a woman is also considered to be postmenopausal only after she has gone a full year, 12 months, without seeing her period. A number of people, when they don't see their period for a few months, they will say, hey, that they have entered menopause. Some people are excited, some people are sad. It just depends on people's mood. And then suddenly, after 6 months, they see it again, and then they become worried. This is one of the signs of menopause, okay? So it's nothing to get worried about, just that you need to be sure of your health at that time. So during the transition period, which is known as perimenopause, like I told us, some people can have perimenopause for 7 years, some people for even up to 14 years. Some people, their perimenopause can start from 41 and even up to 50 years they've not entered their post-menopause, okay? So it fluctuates, it's different from women, one woman to another woman. So a woman can go through months without a menstrual period, but then menstruate resetting again in the cycle. So during this time, hormones fluctuate greatly. And one of the main hormones for women are estrogen. And it is this hormone that is, thought to provide a key heart protection that women experience earlier in life. Estrogen is one of the key hormones that help protect our heart, our vessels, our system, our organs. Estrogen is one of the main hormones. So when this estrogen level drops, and when it fluctuates, you can then imagine what will happen to a woman's health, So once a woman becomes postmenopausal, her estrogen level remains low. So it's not a matter of, what do I do? What do I eat? You can eat anything. Your diet can help. Your diet can actually help you to improve that. I have a delivery I'm doing for the first time through one means in Calabar. They have been calling and disturbing me. If they call again because they are trying to quench me, I need to tell them to stop calling. So I might answer it during this broadcast. So like I said, it is the estrogen hormone that provides the key heart protection that we as women experience earlier in life. So once we become perimenopausal and it's fluctuating and dropping, or we become postmenopausal, then that estrogen level remains low. During perimenopause, it fluctuates, but once you enter menopause, it remains low. So you must supplement. That's the truth of the matter. You must need supplementation. And for those of us going through perimenopause, going through menopause, there's one supplement that helps improve your estrogen level, that helps maintain a consistent estrogen level. It's called Vitalize Women. Vitalize Women. I am just opening my bag to get my Vitalize Women because it's with me everywhere I go. I will tell you a story of what happened one time concerning this Vitalize Women. What happened to me? There was a time I just told myself, after I was having hot flushes before I started using Vitalize Women and some of the other supplements that one needs, and I just told myself, why would I just be using the supplement all the time? I'm going to stop it. Before that, I had one very bad experience when I started my perimenopause. My period will stop for like 2-3 months, 4 months. I will not see it. Then when it comes in lumps. You would think maybe somebody is there was one day that I was in the toilet and something fell off me. I said, today I'm going to see what it is. It was clotted blood, so big like this. By then I was even already bleeding for like 2 months non-stop. I had gone to the clinic. They gave me one injection, and they say that injection I will take it every month. And every month, I can remember that was like this thing was like 4 years ago or so, or 5 years ago, before I started this forever business. So they gave me the injection, and after 1 month I went again. They gave me injection. They said I'll take it 3 times. The 3rd month they gave me the injection, and each time they give me that injection, it is 45,000. Then I pay 5,000 consultancy. That's 5 years ago, and then they give me some other medicine. So I was spending like 60 to 70,000 each month that I visited the hospital at that time. Then after the 3rd month, I felt okay. I was okay. I now stayed. I stayed for like 2-3 months. All right. So what happened was that, all right. So at that period, I was telling you a story. After 3 months of taking that injection, I stopped. After 3 months, then it started again. I started bleeding every day again. So I now told myself I wasn't going to go through that, procedure again. I now got Vitalized Women. Vitalized Women, because I wasn't using it then. I was like, I didn't need it. So I got Vitalized Women, and I started using this Vitalized Women. As I started using this Vitalized Women, I used it for like 2-3 months. I noticed that my period stopped, and then now went back to my normal cycle. And also about that period, I was also having hot flushes and the things like that. I was taking multi-marker, but I wasn't taking it very frequently. I became using these 2 supplements frequently. These are my own containers. They are all open. I am on a trip, they are all open. These are my containers. I open and I use them. So to tell you that if you're going through menopause, you must not miss these 2 supplements. They are very, very important for you. And if you're having metabolism issue, and you can also add Forever Big Polling. These 3 very, very good for menopausal women. So I was telling us that estrogen drop can cause that, and this supplement, Vitalized Women, is one supplement that can help your estrogen level to be balanced and remain at a high level. So what happens when your estrogen drops? I'm going to tell you 6 things that happen, 6 to 7 things that happen when your estrogen drops. Number 1, when your estrogen level drops, your heart and your blood vessels become stiff and less elastic. When you're no more your estrogen level, you're no more producing estrogen hormones as normal because of menopause. One thing that happens is that your blood vessel becomes stiff and they become elastic. And because of these changes, your blood pressure tends to rise, causing hypertension. Elevated blood pressure can also place added strain on your heart. And this was found, and there was a medical doctor, Joanne Fordy, a medical director of the cardiovascular wellness program at Brighton and Women's Hospital. She did use some women to do some tests, to run some research, and then found out that once there's a estrogen drop in estrogen level, the stiffness comes, this less elastic blood vessels become, and the women become hypertensive. So, and that is why it's recommended that as you're going through your menopausal period, you should be on some supplements. And for people who already have history of heart diseases, or people who are having overweight, or people who are obese, or people who are having those risk factors that I mentioned initially when we started, okay, must go on some supplements, and they are Active C, garlic thyme, aloe vera gel, and cardio health. Now I don't have some of those things. I have my cardio health with me, I have my IG with me, I have my aloe vera with me, because I know that my daddy had in my family they have a history of an increase in blood pressure. So at this stage, what do? I go on those supplements. I take Active C, I take aloe vera gel, I take my IG, I take my cardio health. I take my cardio health and my IG every night for prevention. And so that, because I know I'm not producing enough estrogen like I used to when I was younger, so I need to do this. So what is in your family history? Check your family history. What have you been passing through when you go to the hospital? What are the doctors telling you? That's what will determine the kind of supplement you should add. I mean to add though, because for every menopausal women, these 2 supplements must be by your side. It's not to add. Like if you're having metabolism issue, you add B-Poly. If you're having high blood pressure issue, you add ActiC and add IG and add Cardio Health to them. So it's like that and like that, okay? Then another issue is high cholesterol. When your estrogen level drops, you know, your cholesterol also is changed. So lack of estrogen can also be detrimental to the changes in your cholesterol and also your blood fats. Your good cholesterol, which is a high density lipoprotein, may go down. And then the bad cholesterol, which is the low density lipoprotein, may go up. So if the low density is going up and the high density is coming down, then that can cause some heart problems and heart diseases for you, okay? And it will also increase your risk of heart attack, and also people who may die from, you know, heart diseases. But God forbid, none of us here or Aging with Grace anybody will have any issue or death or stroke or dying from heart diseases in Jesus' name. Amen. Also we have the triglycerides. It's another kind of fat in the blood. It also increases because of drop in our estrogen level. And again, if you're having cholesterol issue, there are 3 supplements that you must have. They are ActiC, garlic thyme, and aloe vera gel. I don't have those issues, so I didn't come with my supplements. But if you have that issue, chat me on my number that is pinned on the screen, and I'll tell you how you can get your ActiC, your garlic thyme, and your aloe vera gel. Then another risk for people who are having at menopause is diabetes. Hello Florence, you're welcome. Welcome Doris. Okay, I have some questions. I'll take our questions very soon. Hello Ibo, you're welcome. Welcome here Tunde Ayorinde. Olotu Victoria, Rose Mokodi, you're welcome. Nabueze Ogechi, you're welcome. I'll take our questions very soon once I'm through with this session now. So diabetes, when women go through menopause, they can also become more resistant to insulin. That is, of course, I've told us when I treated diabetes that insulin is the hormone needed to convert blood sugar and starches into energy for the use, for your cells to use, okay? So when during menopause, we become more resistant to this insulin, and so we don't convert sugar and starches well as we need to, and that's why watching your diet is very, very important. So as a result of this, women are also more likely to become pre-diabetic or diabetic perimenopause to menopause. So they become pre-diabetic or they have type 2 diabetes as they transition from perimenopause to menopause. So having diabetes puts you also at a higher risk of heart diseases and stroke. See, today we are treating menopause and heart diseases, okay? Yes, last Monday, I think we treated menopause and arthritis. I told us that this month I'm looking at menopause, middle-aged women, because most of us are passing through perimenopause, menopause, and postmenopause. And I want to relate it with some of the issues of diseases or ailments that might come to us during this period. And that's why I'm saying, if you're diabetic even before you enter menopause, or you become diabetic out of pregnancy or diabetic out of menopause, it can also lead to heart diseases. So having diabetes puts you at a higher risk of heart diseases and also stroke. So for people who are diabetic, I advise that you use your Fields of Green, your probiotics, your aloe vera gel, and of course your Vitalized Women that is steady for anybody who is going through menopause issue. All right, so another thing that happens, you know, that when your estrogen level drops, women may also have an increase in abnormal heart rhythm, like atrial fibrillation. You know, you'll be having like palpitation. That's the atrial fibrillation. You'll be having, they call it AFib. You can be having AFib, and this is around that time that you go through menopause. Your heart will just, sometimes it will be beating faster for no just cause. You can just be on your own and it will start beating faster. You know, sometimes hormonal changes can also cause slowing of the heart and heart blockage that can also cause symptoms including dizziness during menopause. Some women feel very dizzy if they are going through this heart and AFib. Okay, so most commonly, the change in your hormone also can cause a faster beating of your heart, to do as if you have just finished running. So atrial fibrillation can also be brought on by high blood pressure. So we need to be very, very careful here. Know what is causing your atrial fibrillation. Is it blood pressure or is it menopause? If it's just a matter of menopause, it's easier and can be handled and better. But once it's high blood pressure causing it, you must make sure you run to the hospital and get treated. So, and again, menopause, during menopause, we have all these heart issues, palpitation, atrial fibrillation, and things like that. So go on your Active C, go on your garlic thyme, and go on your RG Plus, and of course aloe vera gel will help you. Another issue that we women during menopause have is weight gain. Why? Because estrogen affects where we store fats and how fat is burnt during menopause. Once, like I tell us, once you've reached middle age, no matter, you know, when you're eating and your fat is being stored, it's no more stored in the, let me put, in the less risky places, in the healthy places. They are now visceral fats around your midsection. And that's why you find out that no matter what, sometimes you will say, why is my stomach coming out so much? I'm not even eating as much as I used to eat. He said, of all these exercises, I'm not even eating so much. This one, why am I getting? That's because of your age. That's because of the period you're going through. It's not a matter of you now. And that's why you need to have better, higher, and more concentration on what you eat, your lifestyle. During menopause, we must do 3 things. First of all, change of lifestyle. You're no more young. Number 2, diet. You must watch your diet. Number 3, your exercises and activity. You must watch your exercises and activity. And number 4, your mental and psychological health. You must watch it at that period, because you know that period is when your children are going from secondary school to university, from university to looking for work, getting married. So there are a lot of pressure coming from this world and society. So it's another form of health that you need to watch. So if you're having issues with weight gain, unnecessary and unexplained weight gain, then you're having issues with your metabolism. You need to check your metabolism. So you can go on, like I said, Big Polling or Forever Farm. Those 2 can help you. Forever Garcinia, I have my Garcinia in my bag here. Okay, yeah. I have my Garcinia. I also have my lean. Like I told us, I travel everywhere with my lean. It's on the dining table. My lean is always near where I will eat, because once it starts, once I'm about to eat, I'll take 2 capsules of my lean and put in my mouth, because Forever Lean helps to burn fat and also helps the fat not to be stored at your visceral section. So menopause can cause your metabolism to slow down, and this will contribute to weight gain. And also, it can also bring stress to your heart and also increase your risk of heart diseases. So please watch your weight. I have a woman who is starting Clean 9 in US tomorrow. So her product arrived today and she was so excited. So like I said, I usually have periods that I have group and team Clean 9 to detoxify our system generally, and then also to lose weight and jumpstart your weight loss. But I also handle it personally for people, because sometimes some people can't join the team. We just finished one in July, so she's doing her own now, so I coach her personally. I also coach people personally on that. You can chat me on my number on the screen if you need help with that. All right, so what are symptoms of heart diseases? With menopause, factors conspire to change a woman's risk for heart diseases. So many factors that I have described, they conspire. They have a conspiracy against you and against your health. So it's important for us as women to understand that while menopause transition is natural, some of the symptoms associated with it, such as heart palpitation, or increases in the blood pressure can have a significant consequence on your health. It's natural, but watch the symptoms and how you go through it, because that's what will determine. Because a lot of people, post-menopausal women, that's when they say it's old age disease. No, there's nothing like old age disease. Let me tell us, there's nothing like that. My mentor, one of my mentors, she's 75 years old. That woman is still wearing her heels. I can remember when we did marathon walk, I think it was 2 years ago. This woman did not sit down. She walked all the way at 74 years. She walked, those of you that know Lagos, she went from our forever office at Aromire, went down Owolowo way all the way through Oregun Road and came out on Allen, and then came out at Okpebi Road, from Okpebi Road to Allen. Before, this woman did not sit down for 1 second. She was just with her Aji bottle. She mixed her Aji, fields of green. She doesn't joke with those things. She was just sipping it and walking, jeje. And she was wearing her canvas, you know. So there's nothing like old age disease. You can go out, you can prevent all these things. That's what we're saying. So it's important for you to understand that your menopausal transition might be natural, but some of the symptoms that are associated with it, such as heart palpitation, high blood pressure, and some other things, can actually be significant. It can have a significant consequence on your life generally. So check yourself. Go for your annual review, or biannually for those who are a little younger. If you're 50 years and under, biannual, 2 times once in 2 years. If you're 50 years and above, please make it every year. And if you're like 65 and above, every 6 months, go and check yourself. It's very, very good for you. So what are the symptoms of heart diseases? You need to be very, very careful and note these symptoms. If you're having any of these symptoms I'm about to mention, please look for help, okay? Seek out for help. Number 1 is palpitation. Don't assume palpitation are natural flutters. They are not natural flutters. It's important to identify if what you're going through is atrial fibrillation. You need to identify it, because this heart condition increases the risk of stroke. Atrial fibrillation increases the risk of stroke. So you need to be very, very careful. The second one is shortness of breath. If you were able to go up the steps before very well, and now you find it difficult, then you are having short breaks, short break, then you need to be very, very careful. If before you can go through 2-story building, go up, and you're not having issues, but suddenly you now notice that you need to be very, very careful about it. It could be a sign of congestion or of a congestive heart failure or coronary artery disease. These are some of the heart diseases that we have. You will need my book. Yeah, that reminds me now. If you don't have my book, Healthier Heart, let me find it on my Google Drive. If you don't have that book, when I mentioned this, I just remembered. I said, wow, yes, I've treated all these heart diseases and what you should do about them. Immediately I looked and I saw coronary arterial disease. I remember that I had treated that. So let me just quickly show you my book on heart issues that you need to get. Ebook. Okay, where are you? Yeah, okay, so that's my book. It's opening. Network will open it for me. I should have just shown it here. Okay, so anyway, these are where I have a list of my books. So I don't know if you can see here. These are where I saved the list of my books. So this is my book on heart. It's called Healthier Heart Guidebook. Okay, you need to get that book. It will show you how you can have healthier hearts. And the book is supposed to be 4,000 naira, but I'll do promo for 2,005 today. So you can chat me on my WhatsApp number and I give you the book at a promo price of 2,500 naira. It's an ebook, so you download it. Your book is a fantastic book. I think it's my second best book. My best book is the book on diabetes, and this heart book is the second best book. So shortness of breath is also one of the most common symptoms, like I said, of atrial fibrillation. So if you're having shortness of breath, please, you need to do something about it. Then the third symptoms of heart disease is pressure in your chest. it could be an indication of heart disease. You know, some women think that unless they have crushing chest pain, that's not it's not a heart attack. So, but when you have pressure on your chest, you will know it yourself. You know, you need to be careful. You need to check it. Then if you're having a feeling of fullness, squeezing or dull pressure in your chest that doesn't go away, or it goes away and then it comes back, it could also be a sign of heart attack in women. So those two things you should check. The pressures on your chest could either be like a crushing chest pain, and then it could also be like a feeling of fullness and a squeezing, as if you've overeaten and then it's squeezing. It could also be a part of a kind of a sign for you. Then another sign for heart diseases is headache, frequent headache, migraine, and frequent headache. You know, it could be a sign that you have high blood pressure. So you need to go and check your vitals, okay? And then lightheadedness and dizziness. This could also be caused by a number of disorders, including diabetes, heart failure, and heart, you know, diseases like atrial fibrillation. So you also need to check that. Then another symptom of heart disease is jaw ache. When your jaw is aching you, it could be a sign of an unhealthy heart, and it's also a warning for heart attack in women, okay, middle-aged women, when you're having serious jaw aches. Then also swelling of your feet, when your feet is swollen, that it could be fluid that is accumulating in your leg as a result of congestion and heart failure. Then also if you have difficulty, that's the 8 signs. Now I'm giving you the 8 signs. I'll just read through them. You know, I'm explaining them. I'll read through them again. You know, if you're having difficulties lying down, it could also be a symptom of fluid pooling in your lungs as a result of congestions and heart failure. You know, so if you're having difficulties lying down. So what are those 8 signs that you need to watch out for during menopause that can be an indication of heart issues, that can be an indication of heart diseases? 8 signs. I'm giving you 8, but I published 7. So I'm giving you this 8 now. Number 1 is palpitation. Number 2 is shortness of breath. Number 3 is pressure in your chest. Number 4 could be headache. Number 5, lightheadedness or dizziness. Number 6, jaw ache. Number 7, swelling on your feet. And number 8, difficulties to lie down when you want to lie down. All right, so let's look at prevention and reversal of heart diseases in menopause. Okay, so before we go through it, I also want to tell us again, and then I take a few questions. You need, as a woman going through menopause, to have what I call routine supplements that you take. That's the truth about it. Thank you for the love. Thank you for the heart and thumbs up. You need routine supplements as a menopausal supplement to help maintain good level of estrogen, to help maintain good level of your high density lipoprotein and good level of the low density lipoprotein. To also help, remember that estrogen helps to protect your heart. So you need your level of estrogen to be at a good level. So I say that Vitalize Women is one product you should have. Multi-marker added to it, and Forever Polling. So for menopausal supplements, and also menopausal heart supplements, and also menopausal arthritis supplements, and giving us today a 20% discount. And giving us a 20% discount, excepting Forever Move, which remains at 25% discount. Every other one will be at. Some people were begging me throughout the week. I said no, it's 10% I'm doing. So today I'm going on 20% discount for menopausal arthritis supplements, but Forever Move goes at 25%. Menopause supplements 20%. Menopausal heart issues supplements also go on 20%. So one of the good side of all that I have mentioned today is that this is reversible and most especially preventable. They are preventable. If you're 30 years old and you go on your supplements, I tell you, and you live a good lifestyle, you're active, and then you watch your diet, you will enjoy your old age. I'm telling you. But if peradventure you're already having some of these issues, they can be reversed. So menopause is an important time to take good care of yourself, to take good care of your heart. Menopause period, perimenopause, premenopause, perimenopause, and postmenopause period. Very good period and very, very important period for you to take good care of your heart. For example, women who exercise, women who do not smoke, women who monitor themselves for weight gain and weight loss, and women who eat healthy food, nutritious diet rich food like fruits and vegetables, can lower their risk of heart diseases as they age. That's the truth of the matter. So we know that women who exercise tend not to get high blood pressure as much. You know, something happened. Which day was it? Was it yesterday? I think it was yesterday. Well, I'm not sure. Yesterday or so. We were together in a room and we wanted to get something from the wardrobe. And my sister is like, who is tall? They say you're the tallest. But no matter how tall I was, the wardrobe was so tall. So we said we will stand on a chair. So we brought one fragile chair. And she's like, you will break this chair. I said, don't worry. I know how to climb on it and get it. So I climbed and I got it. So my cousin that was there said, hey, it's all these exercises you're doing that is making you flexible like this, because there's a way you can stand without putting your whole pressure on the chair. So I said it's good. See my fitness ball. Done my exercises this morning. I don't joke with my exercises. And of course, Saturday we enjoyed ourselves. You can go and watch Saturday broadcast. It's very, very enjoying. This is my ball I travel with. By tomorrow now, I'll deflate it, pack it in the pack again, and put it in my suitcase. Okay? All right. So women who exercise are more flexible and they are at a lower risk of high blood pressure. So, and then exercise can also prevent your heart from stiffening as you age, because you have better blood flow. Get your fitness ball. You can travel with it, you can sit on it, you can do everything with it that you want to do with it. Also, a healthy lifestyle goes a long way in preventing heart diseases in women. Please, women, watch what you eat. I know why we're in the kitchen and we're preparing meal for the children. Some of you just grab anything and eat. You need to watch it. You know what I do? If I know I'm going to pick rubbish, I make sure I have healthier foods around me. Like when in my room, I have carrots, I have cucumber, I have fruits around me. In my fridge, that's what you see around me. I don't put unhealthy foods around me because it's natural for you to grab them. That's what I talk about, change in lifestyle. So incorporating the following tips into your healthy everyday life may help you. Hello, my network is going down. I need to do something about it. Just give me a jiffy. I'll do that. All right, so I was saying that prevention is better than cure. But if you even have the disease, it can be reversed. So I talked about exercising, I talked about lifestyle change, I talked about diet, I talked about you having an active life and not living a sedentary life. And then I talked about you having things around you. You know, incorporating these tips that I'm going to mention in your daily lifestyle. Number one, avoid secondary smoking, and what do I call it now? Just avoid or quit smoking if you're smoking. You know, because smokers have twice as higher risk of heart diseases than non-smokers. And this also, in addition, eliminating cigarettes stays away. You know, if you want to eliminate smoke, stay away from second-hand smoke, as it also increases your risk of heart disease. What we mean by secondary smokers or second-hand smoke is staying around people who are smoking. If you're staying around people who are smoking, you're a second-hand smoker, okay? Then number two, maintain a healthy body weight. Make sure your body weight is healthy. The more you are overweight, the harder it is for you to maintain a good lifestyle. You know, the more you are over your ideal weight, you know, there is an ideal weight. Everybody, you can't say this is the weight for everybody. The harder your heart has work to give, you know. So you need good nutrients. So when you overworking your heart with overweight, is not good for you, because research have shown that being overweight contributes to onset of heart disease. I can remember when initially there was a time I was having blood pressure which was induced by pregnancy. When I had I can't remember which of my children, but I really added weight a lot during that pregnancy, and I started having blood pressure, and the doctor called me and said, Mommy Joshua, you need to lose weight. That once you lose weight, this blood pressure thing, because I was just going on and off hospital. So I actually went on weight loss program, and when I lost that weight, my blood pressure dropped. So weight can be something that will induce blood pressure. Then number 3, the third thing, you need to exercise. The heart is like any other muscle. Just like the heart muscle is like any other muscle. It needs to be worked to keep it strong and healthy. Remember when people who are doing this, all these boxing people who are into sports, they'll say they are building up their muscle by doing exercises so that their muscles will become firm and things like that. It's the same with your heart. So you need to be active to build up your heart muscles. Being active or exercising regularly, ideally for at least 150 minutes a week. That's ideally. Divide it by 7, what do you get? Or even divide it by 5, that's like 30 minutes every day. You need to do like 30 minutes every day to help to improve your overall well-being. And then it also helps to improve how your heart pumps blood throughout your body. Activity and exercise also help reduce your risk of heart diseases. It also helps to lower your high blood pressure. It helps to lower the low density lipoprotein. It reduces stress for you. It helps to keep your weight off and also improves your sugar level. I've done all this when I'm treating all those things. I've done exercises that can help you, and how they help you can go and watch. Go on my page. If you don't follow me, click on the follow now and like my page and follow me so that you can be getting notifications when I go online. Okay, so check yourself, like I said all the time, and make sure these things are okay with you. Then number 4, you need to eat well. Food is not just food. You know, some people, they will grab loaf of bread, just grab it and say it's just to fill the stomach. When your body is hungry, your body is not just hungry for you to be satiated. Your body is also hungry because you need to give it the nutrients, the minerals, the macro and micro minerals they need. You need to give it the vitamins that they need. And that reminds me, when I mentioned macro and micro, I remember that nature meal. This nature meal is one supplement also that is good for menopausal women. It gives you the very good number of, I think it has up to, I can't count it, maybe more than 10 micro and macro minerals that you need in your body here. So it's also very good. Hey, I'm tempted to chew, but let me wait before it makes me to come. So you need to eat well. Follow a diet low in saturated fats, low in trans fats. When we mean trans fat, especially hydrogenated fat, and also take diets that are high in fiber, take whole grains, take legumes such as beans and peas, take fruits and vegetables, take fish, salmon, fish, mackerel, fish that are high in omega-3 fatty acid, take folate-rich foods, take soy. Soy is very, very good. I have my soya milk, forever, whatever here, light ultra here with me. Then number 5, the 5th thing you need to do to prevent and reverse heart diseases in menopausal women is to treat and control medical conditions fast. Don't wait until they are very detrimental before you do it, like diabetes, high cholesterol, and high blood pressure. No risk factors of heart diseases. You need to treat them very, very well. Ask as many questions as you ask privately on WhatsApp. I'm going to answer you, but I need to go now. I love you all. Bye. See you on Thursday. God bless you.